Good afternoon, everyone. This is the November 8, 2024 meeting of the Study Commission on the Environmental and Public Health Impacts of Per and Polyfluorinated Chemicals. We have a quorum, so the meeting is called to order at 2:02 p.m. And we'll begin with the October 2024 minutes. Are we able to take a vote on that? Okay, that was.
I move to approve.
Okay, motion by Don.
Second.
By Laureen, thank you. Any discussion? All those in favor, please raise your hand so I can see. And
Chris, I need to abstain because I wasn't there.
okay, who said that?
Amy.
Amy. Okay, and Ron, you abstain, and
Yes.
Joe, you do as well. Okay. Okay, so very happy to have first on our, Mike.
Sorry about that. I was just a seconds too late. I had taken a look at it. I know it's not critical, but I did note there was one typographical error on page 12. Sorry about that. It could be a point of confusion. The last sentence in the first paragraph on page 12 uses the term LSR, talking about the rulemaking, and that should be final proposal rather than LSR. Sorry, I didn't get that. I was desperately trying to find my notes on it.
Okay, and I was turned with my head away. Should be what instead of LSR?
Final proposal.
Final proposal, okay.
It's basically what the item says that we filed our final proposal of the rule. LSR is a legislative service request, which is another matter entirely.
Got it. Okay. I'll make that correction.
Sorry about that.
It's okay. So anyway, very happy to have with us a presentation from Joe Ayotte this afternoon on USGS work that's been ongoing in New England. So,
well, the U.S.
The U.S., okay. Go ahead, Joe.
It applies to New England. So I do not use this platform, so I have no idea how to share my screen or whether I can or.
Joe, give me a second. I'll give you permission.
All right, thanks. Sorry.
Not a problem. You should be all set.
Okay. Show screen. Is that the button?
Yes.
Okay. Let's see what happens. What screen am I showing?
We can see your PowerPoint.
PFAS.
PowerPoint. Great. Let's see if I can make it in slideshow mode. There it is. How's that look?
We see your presenter mode, so you need to just flip your display settings to.
Oh. Any idea how to do that?
Go up to the top to display settings and hit that little down arrow, and you should be able to go up. Yeah, right there. And swap presenter view and slideshow.
There we go. Beautiful.
There you go.
Excellent. Oh, you guys are so good. Thanks. All right. Well, thank you. So I'm sorry if this is if I misled anyone by thinking this was just New England, but it's the U.S. and it's actually I can't see anybody now, but did any of you see the press release at the end of October about this this research? Or is this all new to folks?
Gary, certainly new to many of us. So.
Okay, great, perfect. So this is work that was done by, well, multiple mission areas at the USGS, but primarily our water resources mission area. And it's kind of I'll get into it a little more detail, but it's related to work that was part of our National Water Quality Assessment Program, which has now morphed. But the goal of it really was to see if sense could be made of where PFAS might occur across the US. In fairly good detail, they used a 1 kilometer by 1 kilometer grid across the US and applied this predictive model. And it does pretty well. Somewhat astonishingly, but also somewhat not very astonishingly when you think about the variables that lead to the occurrence of PFAS, and I'll get into that. So it's largely work by Andrea Tokranov, who you may know. She led the New Hampshire soil survey work a few years ago and has been doing a lot of things since, including this. And she has a wild cast of characters as co-authors from across the US at USGS offices. And so this is really her work. So you've probably heard about machine learning models or AI-driven models. These are models that utilize a lot of data, look for patterns, patterns in data, and then to come up with predictions of where things might occur or what concentrations might be and things like that. And this is one of those kinds of models. They've been performing very well on environmental data, so they're kind of popular. What they did was they summed up concentrations of 24 PFAS, and wherever we had any measured, that was considered an event or a PFAS detection. And the model was developed to predict those kinds of occurrences. So not a concentration model, really just an occurrence model. And then the work then went on to combine that information, probabilities of occurrence of PFAS with population estimates using groundwater for some kind of groundwater for drinking water supply. And in particular, this is untreated water, so it does not account for whether a public or private system treats for PFAS. So it's sort of a worst case scenario in that regard. And this was published in the journal Science in late October. The presumed or hopeful outcome of this is that it can help water suppliers, managers, regulators, others look for places where PFAS may occur and potentially guide future studies. It does another thing, in case I forget to say it later. It really kind of underscores the complexity of PFAS from multiple sources, and I'll show that in a bit. But I think it really hits home with how much there is out there from so many different sources across the landscape, and we'll take a look at that. So I mentioned that this was part of our National Water Quality Assessment Program, NAQUA, if you've ever heard of that acronym. It's now called the National Water Quality Network -groundwater. And in 2019, they had collected a bunch of samples in the eastern half of the US. Since then, they collected a bunch shown in pink in other parts of the US. And that's really the data set they used to train the model. The beauty of it is it will be, as they do more long term, it'll show trends over time, and it's consistent in the manner in which it's collected. The wells were all randomly chosen from protocols for the study, and in that way they provide pretty good and solid information on PFAS occurrence. And there's also a lot of ancillary data that goes with these. So we know a lot about the water that has the PFAS in it. Did I just lose my screen?
No.
I see pictures of all you guys again. For some reason I clicked on something. So let's see. We used something on the order of, if I can put this down, I can see. There we go. I think they had 1,200 or so wells, 1,300 wells that were used in the study to train the model, and from a variety of networks. Our National Water Quality Network did not include California as much as we would have if California didn't have their own program, which they do. So their program models after the USGS one, making the data very compatible and comparable. So we ended up using their data in this as well. I should add the paper on and the URL go to the first attempt, which was in 2022. They developed a preliminary model for the eastern half of the U.S. with the initial data and found that it worked so well that they thought it would work equally as well for the whole nation, and indeed it did. So here we are. This is a little bit about model development, the variables that were used as predictors. And you can see clay content, predictions of nitrogen, nitrate, groundwater recharge, pop density, and then other things like distances to potential PFAS sources. Those were derived from the EPA PFAS tools data layer, which is shown here. And you can see this is kind of mind numbing in a way to think about all of those dots as sources, potential sources, and just how intermingled they are, all the different sources. And it turns out this was a very predictive data layer for the modeling work that was done. So here's the results really in a picture, in a map. This is for public supply, and you can see the probability categories on the lower left out of a total of 1. So the blue areas are fairly uncontaminated, and the red areas are quite a bit contaminated, if you will. There's also a map for private domestic supply, and we were able to do that because we had previously in this program developed a data layer, national in scale, same 1 kilometer grid spacing on the depths to the top and bottom of aquifer units used for public supply and the depth to top and bottom of units for private supply. And as you probably know, those vary considerably across the US. But it turns out to be a very good data layer because it allows us to predict in places where we don't have all the information we might want for a well, if we know what kind of well it is. And it also makes the predictions more relevant to the used resource. So along with those 2 maps, the authors developed a PFAS interactive dashboard, and this is it. You can navigate to this, and this is the picture for the nation. Again, you can see the wells used here, and you can also see the probabilities in the background, but you can zoom in, and I'll show some of that in a moment, which is really nice. You can get a feel for the complexity and the different likelihoods of PFAS contamination being present in public or private groundwater supplies. So key findings. They considered the probabilities at 2 different probability cut points. So historically or frequently, if the probability is less than 0.5, it's considered not a detection. And if it's greater than 0.5, it is considered a detection. But they also did it at the threshold of 0.3, which shows a little bit more area with PFAS than it would otherwise, but there's reasons for doing that. Those are all spelled out in the paper, but that's the reason for ranges here. So what they're saying is that there's quite a bit of land area in the US, 13 to 15% at the high end for areas that are contaminated with PFAS. And or affected by PFAS. And then that equates to about 71 to 95 million people. And you can break that out by public and private supply, which they've done below, 58 to 77 million for public, 11 to 18 for private. And I'll zoom in on New Hampshire in a moment and show you how that, well, right now, and show you how that kind of looks. So this is, I apologize, it's not a very clear screen grab, but you can get the idea. This is most of New Hampshire, and you can see the probability ranges shown here in the legend. This is from the dashboard, the interactive dashboard, so anybody can go in and make this view. And this is the probability of PFAS in public supplies. And you can see it's pretty variable and pretty mappable based on the model parameters that we used. If we take that to, this is in a table in the report, in the supporting information. It's done for every state. It's broken out by public and private supply. Their results estimate about 200,000 to 280,000, or 0.2 to 0.28 million people on public supply in New Hampshire, and about 0.1 to 0.2 million on private supply. And then you can add those up and get about 0.3 to 0.5 million people affected by some PFAS contamination in source water in New Hampshire. So that's the New Hampshire estimate from this. Again, you can zoom in quite a bit more, look at things in a lot more detail, and at least get a hint for where PFAS may be problematic or may not. I will point out a couple of things. I don't need to say this, but I will. It's a model, so right away, we all know that models are not 100% correct. But more than that, it's very tempting to zoom into the pixel level and look at a single pixel, but we, or the authors, caution strongly against doing that, because that's really not the intention of the modeling or how the accuracy of the model was evaluated. So it's really not effective at that scale, if you will. Nevertheless, when you zoom back out a little bit and look at groups of pixels like this, you can get a really good sense of where PFAS may or may not be. So that's largely it. Next steps for these folks, they're hoping to build this into a full-on concentration model, and that will probably result in multiple models, with some of them being sums of PFAS concentrations at a well, and they may also, I'm sure, look at individual PFAS compounds with the model. So that's really where I'll leave it. The paper is located at this first URL. The interactive dashboard is here. The second URL, and the data release where all the data used in the modeling is also available if anyone wants that. If I'm not taking too much time, I have two other comments to make on this.
Please do.
All right, so it's a model. I don't want to speak disparagingly about models. I love models. But I do want to say this, and this is true of most of the modeling work we do. It's not just taking data and seeing what the model gives us. It's really founded on a lot of foundational studies. There are studies that look at things in either excruciating detail or at the state or regional level, or whatever it is, multiple scales, really. And these studies, you can see there's 5 papers here just on work done at Joint Base Cape Cod. And these figures represent for us depictions of process-based understanding. So I just wanted to put this in front of you to convey to you that we tend to combine our understanding and knowledge at the process scale and local scale to regional scale into information that we can then use to generate models. And that's how the process tends to work for us. And that's iterative as well. Sometimes the models don't work very well and you go back and get further understanding and then go back to the modeling later. So there you have it. I'll leave it at that. Thank you for that.
Okay, thank you, Joe. Do you have permission or authority to let us include your slides with our minutes?
Anticipating that, yes, I do.
Okay. If you can, please forward them to me.
I will do that.
Thank you. Okay. Questions for Joe? Oops, made it read.
Sure, fire away.
Okay, Lorraine?
Lorraine.
A couple of questions. One, New Hampshire, you know, we've had immense amounts of modeling and data collection, way ahead of the nation there, I suspect. Have you compared the predictive trends in the model to New Hampshire in particular's data? And if so, do we know, or does Mike know? I mean, that's a, you know, not a specific answer, but in general, how does it compare? Because I know our state, you know, had to defend, you know, things like even looking at cost benefit and things like that. And we have a good idea of the impact of PFAS, the costs, how many municipalities, how many private wells. So how does that match up, or does it?
Yeah, excellent question. I love that kind of thing. We have not done it. The authors did it in a couple of places where they had some independent data and could test it, and that's in the paper. But they couldn't do it everywhere. It was kind of beyond the scope to do that. That said, that would make a fantastic follow-on study.
It would.
And here's why. I mean, it does a couple of things. And I know this because I've done it. Let me preface this with 2011, I made an arsenic model for New Hampshire, and it's still being used. It could be updated, but it's still being used. And 10 or so years after we developed it, I had an opportunity to get independent water samples from wells analyzed in conjunction with UNH. I was working with the geochemistry lab there, Julia Bryce's lab, and it was pretty cool. So suddenly we had 500 more samples that were not part of the original model, and we did exact model. No one ever tests the models, and they still don't. It's very rare to do what you said. So we tested the model and we found some good things and some bad things. And I suspect that would happen here. The good things we found were that where we had a lot of data originally, the model was pretty well constrained and predicted quite well. Where we extrapolated through the modeling to areas that were previously unsampled, it didn't do as well. And we were not surprised by that, especially with a geogenic or a geologically forced contaminant. But it's a very important exercise to do because it shows you what you don't know, and then you can improve it. And that's kind of the iterative process I was hinting at. I think with this PFAS data, you know, it's not geologically sourced. It's more likely to do well more widely than what an arsenic model would, but that would be a fantastic follow-on to this.
I think we just have such a richness of data in our state, and it always frustrates me because I like to see it all pulled together. We can do so much more, and then we still have data gaps. I'm assuming in this model, when you say PFAS, right? I don't know what panels you're looking at. You know, that's an issue for me always. And are you aware of, I'm assuming the answer is no in this particular work, but are you, just out of curiosity, are you aware of any work right now that is really analyzing either modeling or data sets incorporating TFA, because, we do know that it is vastly representative and exceeds many, many other PFAS. Its health links, I believe, are linked to reproductive and liver toxicity, I think. So it's a tough one, and it's a huge data gap, and it's everywhere.
Yeah, I don't know of any that's modeling that's addressed that. Andrea would, so I will make a note and ask her that question. Others here might as well, but I can certainly ask Andrea, and she would know.
I'll mute myself, but I just want to make the point that, we can get complacent, especially here when we say, oh, we filtered our water, but PFAS is complex and there's so much more work to be done. We have to remember that. Thank you.
Yeah, if I had a nickel for every time somebody told me tested our water and it's good, I could retire. I could have retired earlier. Yeah, good points.
Other questions? Don?
Yeah, thanks for that, Joe. Would this model be used as a way to maybe go out and look and confirm if there is PFAS contamination in those spots that are identified, as a tool to kind of like focus our efforts on in those areas? Is that kind of the purpose of this model?
It's certainly one of them. Yes. It's multi-purposed. I mean, just one, you're thinking beyond New Hampshire, but not entirely beyond New Hampshire. I mean, previous to this, we didn't have a very good understanding of the potential exposure to any PFAS in groundwater drinking water sources across the US in a comparable fashion. And so now we do. We have, when you make these coast to coast models like this, with apologies to Hawaii, Alaska, and territories, we suddenly are able to analyze the data in so many other ways. When I showed you the data that we used, you could see there were little clusters of data across the country, and then there were big gaps. Those clusters represent very important drinking water aquifers that have been mapped for eons and continue to be mapped. And we focus on those because they represent massive bodies of groundwater used for drinking water supply. Yet they don't go coast to coast. There's gaps, and then those gaps make it difficult to use environmental data in public health or other kinds of analyses. And we've known that for years, and public health has known that for years. And only recently, since we started developing these models at various scales, have we really been able to get together with public health scientists and do the kind of work we've all been hoping to do for a long time. So that is also one of the benefits of having this kind of data.
And do you know if the model included the load of PFAS from the EPA database? I assume you went and looked at wherever there was was there a list of PFAS generators that you looked at, and then like aerial deposition, wind currents? How sophisticated is it? Does it include all that?
Not that sophisticated. It includes largely the stuff from that ECHO PFAS tools database, and then a bunch of other, I'd call them mappable explanatory variables. If we had our druthers, we'd have mapped variables at all kinds of depths. And I mean, we'd have 3D basically mapping of the explanatory variables, but we don't have that. Some of them it doesn't make sense for, but others it makes a lot of sense for. And the whole depth of drinking water supplies, public and private, that starts to get at that depth. So we're kind of quasi 3D, but as models go, this is fairly simplistic, yet clever. And then as models go, it does remarkably well at predicting. So at least, with the data that we have. So to your original point, can you go out and look at other pixels that are high probability and see if there are potential PFAS contamination there? Yes, you can. How well it does in those places is yet to be determined. And, to Laureen's point, I mean, we can test some of that right now because of New Hampshire's rich data set.
Interesting. Go ahead. Mindy?
Thanks. This is great, Joe. When I saw this model, I was thrilled because this is the kind of stuff we really need to do. There's just such an enormous amount of data. We need to use AI tools to assess it. So I think it's a great study. I think to the question, well, somebody's question, wasn't it partially trained also on the UCMR 5 data from EPA? It came through July. I think I read that in the paper. And my second question is, there are two different data sets that I saw you showed that USGS took. You said 24 PFAS, I think were in both data sets, and wondered if there was a difference though in detection limits over time that you were able to account for, because I think 2019 is different than what we have now.
Yeah, I mean, I'll speak to that first. Yeah, there was a difference in detection limits, even for the USGS data in this study and others. Although I will say we've had that issue since I started doing this kind of stuff 37 years ago, or even beyond that, right? Anytime there's laboratory data and time goes by, laboratory reporting limits get lower and lower all the time. So USGS has developed, recognized that, not initially, but we've developed methods for ensuring that we're comparing apples to apples when we look at detections where detection limits vary. And they did do an analysis in this paper of the impact of the changing detection limits. And my understanding is they didn't correct for anything explicitly, but determined that it had a relatively minor impact on their dependent variable. As such, the other data sets that were used, I'm not as familiar with it, I must admit, but I know they did use a variety of data sets in evaluating this, and including the ones where they tested in a couple of different areas. But they were matched so that we had relatively comparable information.
Yeah, like I think was sort of intimidated before with somebody else asked a question, the air, it was Don, having some level of air dispersion in the model would be really important, especially when we know so many places have stacks that have spread the contamination further. Because if you did that when you did that pixelated look in Merrimack, I was like, well, that's not that is not granular enough for that. So I think that would be a nice addition too.
It would, yeah. There are so many. They probably, I haven't honestly, I don't recall. I've read this many times, but there's so much to it. I don't recall how much they said about limitations and/or next steps, but those are certainly important things to think about.
Okay, other questions for Joe? Okay, I do not see any. So moving on, thank you, Joe, very much.
Sure.
Mike, do you want to give your DES update, please?
Sure, be happy to do that. So good afternoon, everyone. For the New Hampshire DES update, we'll start with the Air Resources Division, and this is kind of an administrative note more than anything. On October 10th, the company requested a waiver to the requirement for stack testing pursuant to their state permit to operate. And the reason for that is that everything's been disassembled, they're not manufacturing, and there are no emissions. So that on October 21st, the agency sent a letter approving that waiver. And so that gets us to more interesting information, which is that we talked about, we've talked at length in a number of meetings about the closure of the facility and the work that's been done over the last calendar year to effectuate that. And since our last meeting, shortly right around that time or shortly thereafter, that meeting, the company announced that it had made a decision to demolish the facility. And we're talking about that. We've asked for some written descriptions and plans about what they intend to do, and we expect to receive those. And of course, share those when we receive them.
Mike, I don't know if you have an ability to change your microphone, but you sound like Darth Vader a little bit.
I don't know, maybe I have something over the mic, I'm not sure. Is that better?
You're not really. I mean, you're understandable, but not. No.
Mike, you sound all garbly, like.
Well, I don't know why that is. I'm not sure what.
Oh, now you're echoing.
You have headphones? You have headphones? I wonder if it's the speaker.
I don't have headphones. Is that any better? Tell you what, I'm going to get out and then get back in. Sometimes that might help. So I'll come back.
Thank you.
Is that any better?
Much better.
Okay, great. So I just want you to know, Amy Russo is a full service host. She ran these headphones down to me. So, thank you, Amy. So let me get back to where I was. So as I said, we received notice that they were going to be demolishing the facility, and we expect to get a report on exactly that, how they plan to do that and what schedule they plan to do it on. The understanding right now is that they're doing the notifications and the work they need to do to be prepared to do demolition. Their plans, as we understand it, are to, in essence, demolish the facility and all associated structures down to grade. So they would leave, there's a very substantial concrete foundation there that they don't propose to demolish. That was actually constructed for the first use of the facility, which was, I understand it, was to for General Electric to produce turbines, 2 turbines for the nuclear power plant. And so it's a very substantial foundation, and they don't plan to demolish that, but everything above grade would be expected to be demolished. So we, again, expect to get a written schedule of their plans, and our understanding generally is that they'll look to potentially do some demolition this fall or winter if the weather is reasonably cooperative, and that most of it would occur in the late spring and into the summer of next year. So that's what we know about that for now. Moving on to other topics, the POET systems, as of November 6th, 671 POET systems have been installed. And, you know, the normal confirmation of the success of those is being evaluated. Based on that, 649 of those systems are considered officially complete because they've demonstrated effective treatment through sampling. And then moving on to construction of water lines. The company's proceeding with construction work for water line installations for the towns of Litchfield, Bedford, and Merrimack. These are areas with existing water lines where homes require connections to the water mains in the street, and areas where new water mains will be installed. Construction associated with the Hillcrest Road water main extension area of Litchfield has been underway since October of last year. All water mains for this project have been installed and tested. Water meter installation began in April, and 52 residences have been connected from their or disconnected from their water supply well and are now receiving water provided by the utility. Work associated with the Hillcrest Road project is substantially complete at this point. There are 3 remaining connections to be made by the contractor and some restoration and paving work that's yet to be done. The utilities indicated that 32 properties declined connection to the water line. 14 of them have opted to have a line extended from the curb stop area to the home, but not connect. And 10 residences didn't respond to notices by both the water utility and DES. And 8 residences provided a response indicating that they declined connection to municipal water. And so the water utility will install a curb stop in the street at those 18 locations. The contractors have begun service connections to existing water mains in the towns of Bedford and Londonderry. Service application requests have been sent to 32 eligible properties, and completed applications have been received for 29 locations. Exterior service lines have been installed at 14 locations, and water meters have been installed at 9 properties. Service connection work is anticipated to continue and be mostly complete by the end of this calendar year. However, some interior connection work may carry over into the new year. Saint-Gobain's consultant has finalized design packages for extensions and connections to existing water mains for the Merrimack, and that's Wildcat, Brenda Lane service connections. Service application requests have been provided to all eligible properties. The water main extension on Brenda, John, and Edward Lanes has been installed and testing is complete. Service line connections are expected to start in November and continue through the end of this calendar year. Water meter installation may continue into 2025. Connections to existing water mains in Merrimack and Bedford began in July of 2024. Contractors installed the service line from the stop to end at 22 locations, and water meters have been installed at 5 locations in Bedford and 10 locations in Merrimack. A total of 7 properties have not responded to application requests for these areas. The company's working with the water utility in the town of Londonderry to evaluate water line extension work in that town. The conceptual design was completed by the utility on behalf of the company in spring of 23. We have met with Saint-Gobain, the town of Londonderry, and the water utility a number of times to discuss that project. Londonderry has been approved by the Drinking Water and Groundwater Trust Fund Advisory Commission for an $8 million grant to supplement the towns and the company's contributions to the larger project. Negotiations between the town and the company continue, and so we'll keep you posted on that. With respect to the groundwater management permit, we've certainly talked at length about that. We requested an application for a groundwater management permit be submitted by May of this year, and the company and DES met to discuss the application on May 7th. And based on the outcome of that meeting, it was determined that the company would not submit a groundwater management permit application in June, as had been anticipated. Instead, they proposed to conduct long-term monitoring of drinking water wells under a work plan. And a work plan outline was received in June, and DES provided an approval of the concept with comments on July 30th of this year. On September 27th, they submitted a groundwater management zone work plan to support some of this lead up work. And DES met with the company on October 22nd to discuss the work plan and the contested areas within the consent decree area outer boundary. We provided preliminary comments to the company on that proposed monitoring schedule and plan, and they expect to be submitting a revised work plan soon. So we've been receiving periodically updated proposals from the company to remedy additional water supply wells within the consent decree area following the initial agreements in April and June of 22. That includes a number of term sheet attachments, and we're up to attachment 21 at this point, which was received in September of this year. This attachment includes an updated list of remedies for all the properties since the April 22 proposal, and there's a link in the notes that you can look at that. And DES anticipates that a new proposal will also be submitted in November for further updates. With respect to water supply sampling, I'll keep I provide a lot of background over time, month to month on this, and it'll be in the notes, but I won't necessarily go over all of it. But I would note that the company's contractor has been collecting a second set of samples from all wells previously sampled only once that had exhibited results from below the detection limit up to 10 parts per trillion. And as of September 24th, second samples have been collected from approximately from 1,193 properties. And that represents about 95% of the targeted properties for resampling. Lab analytical results for the second samples for those properties have indicated that between 5 and 10% of those resampled properties have exhibited exceedances of a drinking water standard. These properties have been issued bottled water eligibility letters. And then with respect to previously unsampled wells within the consent decree area, as we've discussed a number of times, DES has consistently expressed the need for additional sampling proposals to complete sampling of all the water supply wells within the consent decree area. There continue to be some contested areas where the company is not willing to do testing. In our recent meetings, they have conceded that there may be a few areas where they're willing to do that, and they're going to be providing us with information about that. But we, of course, back in June, we required that they complete that sampling in a letter. We made that demand again, and they've not agreed to do it. So we decided that we would do some of that sampling in order to not keep those folks waiting. And so we've been conducting that sampling at the remaining homes since I think we began that in, let's see, probably, I don't know if I've got that here, but generally early this year. So we, oh, that's right. The effort was initiated in March of this year. And as of November 6th, approximately 85 residences have either been sampled or scheduled to be sampled. Results have been received for samples collected from 83 properties. And of the results received, about 10% of the properties have exhibited an exceedance of the current ambient groundwater quality standard, and 70% exceed the newly promulgated EPA MCL. So approximately 66 property owners have not responded to the sample invitation, and one has declined sampling. We notified eligible residents by mail 3 times, and we don't have plans to do any additional mailers at this time, but we'll continue to sample properties when requests are received. Moving on to some of the statistics for sampling. As of October 28th of this year, and this reflects the updates through the Addendum 18 of the sampling plan, 3,867 properties identified for sampling have been identified for sampling, and that's not a change since last month. 3,855 access agreements have been sent, and that's an increase of 1%. It's about a return, with a return rate we're getting is about 73%, and that's up 1 percentage point from last time. 2,571 samples have been collected from water supply wells. That's 3 more than the September report. And 1,193 second samples have been collected from water supply wells, and that includes 1,020 samples that are collected since June of 23. So 1,162 properties have been offered bottled water, and that's 8 more than the September report. And then moving on to the remedial action plan, which we've discussed at some length before. As to recap, we had a RAP that was submitted in May of 2023. We met with a consultant in St. Gobain on June 21st of that year. And as a result of that meeting, they decided to submit a RAP addendum. We met with them and their representatives in December of 23 to discuss the contents of that addendum, which they then submitted a little bit later in February of 24. We provided comment on the RAP and the RAP addendum in an October 10th letter. And a link to that letter, I believe, is contained in the notes for this past month. And there's a link to it here in the notes that'll be provided for this meeting. And basically there were still a number of deficiencies. It doesn't meet the requirements of the rules as we read it. And we detailed those deficiencies in the October 10th letter. We requested resubmittal of a remedial action plan within 90 days. And the company's requested a meeting to discuss the letter and resubmittal of the RAP. So we expect we'll be meeting with them this fall to discuss that. And then, of course, the notes will contain bar charts and pie charts, which illustrate the percentage of POET and waterline connections that have been completed in the various communities. And those numbers are ticking up, which is always good to see. And with that, I'll be happy to take questions. Lorraine?
Thank you, Mike. I read the October 10th letter last night. Wonderful. It was great. Thank you so much. I think I'm very satisfied with it. I don't know if anyone else here has had a chance to read it. I suspect Don has before he put his thumb up. We're right on. Yeah, we have our reasons. And, do what you can. When they request meetings instead of those responses in writing, I can't do anything about that, but it always gives me concern because I don't know, whatever they say is off record, and clearly they've been digging their heels in for what, February makes 2 years now. So if you need anything from, I can't really do much there other than make a lot of noise, right? But be it legislators, anyone, please, I hope we can talk about that. As to the GMZ, I also read that. First, I thought it was that insanely long length as a report, and then I realized so much of it was, addresses and graphs. So the narrative, folks, don't be scared of that. The narrative is maybe a dozen pages. It's very readable. The section in that, well, I know you know what my issues are, but one particular one for nuts and bolts that I noticed was that proposal for monitoring with the wells between the 6 and 11 parts, that they would just monitor and do a retest every 12 years. The national standards were instated in April of this year. It's 4 parts for PFOA. It's only 4 parts because of testing variations across the nation. The true safe amount, as they said, is 0.00004 quadrillion or whatever it is, right? So carcinogen, hazardous substance, not okay. So my concern is we are the Health Commission, in our title here, and the health science, is what this is all about. We have people with private wells who may or may not realize the threats to their children, especially women of reproductive years. We do see patterns and trends with people of all ages. I truly hope, as we've stopped our exposure in our town, as the years go by, people will gradually become healthier. But I don't know what the thoughts are on how we can really take those science-based standards. That science will withstand the legal challenges federally, just as the New Hampshire science 5 years ago did withstand the judge's scrutiny. So can we push there, and can we get those federal standards incorporated into the GMZ and the St. Gobain negotiations, because they are health science based? And the other piece of that I would add in is, I think, as memory serves me correctly, when we passed the MCL legislation a number of years ago, it was stated there that the state would need to do a review of the science. It was negotiated and amended and compromised, which that's how we passed it, with a compromise, which ended up 5 years. We must be at that point if it was 2018 passed and then it was challenged and then it was reinstated by the Senate and the House in 2019, right? And so whatever date we move forward, be it 2018 or 2019, we're for sure at the 5-year mark. So are we due for a process of reassessing? And if so, if we can tie this all together and get that federal standard, because that is science-based, they've done the work for us. So I want to see this all pulled together. 8.5 years of this is, trying to keep people safe. It's tiring. And if we could move that forward on a state level, I think we would have a really good foundation, for safety for all. So I don't know what your thoughts are on that.
Sure. Well, yeah, that legislation actually required the state on an annual basis to review and determine whether it recommended adjustment or amendment of those standards. And that letter from our commissioner goes out each fall. And the letter was issued not too long ago saying at this point, they're not moving, the agency is not recommending moving forward to adopt the federal standard. And I think what the memo suggests is that the fact that these standards are not yet, the water systems are not yet required to comply with these. There's a phase-in period for that, and the rule is still subject to a legal challenge by a number of parties. So I think what the memo suggests is that the agency is watching to see what happens with that. I don't know for sure what the schedule will be for adoption of those, but at this point, the most recent memo recommendation from the agency is that we're not moving forward just yet to do that.
So what has the state done for their review of the science? Because of the state, that took a lot of resources when we did the MCLs, I'm sure. I don't know what your budget is, but you do. So regardless, there was a lot of time and effort. That's when you hired John, right? And I can't remember her name. I can picture Mary. And then there was another gentleman there. 3 of them came on board. And a lot of us here participated in submitting science that we knew of. And that was, we know the science has evolved in 5 years. And I find it hard to believe that there isn't, I know there is actually, the science is there to really justify adopting it. Instead of this watch and see, is it going to be struck down? And if it's struck down, we don't have to do anything about it. And we can just stay at 12. That doesn't feel acceptable to me from a health perspective.
I don't know that what you just described is what really is being said at this point. That really all the memo says at this time, we're not planning to move forward with adopting the standards yet. Doesn't mean that we won't do it. Doesn't mean that we wouldn't do it even if it were struck down at the federal level. But that I'm reporting to you what the memo says.
That's one piece, but how does that jive with the request? I don't know how I missed that annual. In my mind, something was done about 5 years, but maybe it was changed. That's great. How does that jive with the request to revisit the science that's in there? And what's the process for revisiting the science, regardless of federal, right? If we put federal aside, what is New Hampshire doing to stay current with the health science to make sure our standards that we placed 5 years ago are current from a health science perspective? I hope that was better. Guys.
Sure, I understand that. Yeah, no, I get it. Each year, our staff in the environmental health program have reviewed the information and the data, and that it helps to inform the agency's decision about that.
So can I ask a question to follow up on that?
Go ahead.
What kind of information did they get that said we shouldn't, from a health perspective, not adopt those numbers? Obviously, like the EPA spent a lot of time coming up with their final conclusion. It sounds like New Hampshire was using a different set of data.
I'm not the expert on that sort of thing, so I can't tell you exactly what has gone into that. But I'm here to tell you that's what the most recent recommendation from the agency has been.
Nancy?
Well, thanks, Chris. Sorry. So thank you, Mike, for that. Is there a way that we can get that information? Because I think that this is like really critical. And it just would seem if we're supposed to be reviewing this annually, federal government has done the work. I'm confused why we wouldn't. So I would just, is there a way, I don't know who we would get that from, but I think that's really important to our work, is to have an understanding of what scientific basis that decision was made that we would not go forward with recommending that we do this here in the state. And I'm just really confused by why we wouldn't. To me, it just seems like a no-brainer.
Mm-hmm. Yeah, we can provide any background documents associated with that. Happy to do that.
Thank you, Mike.
Mike, let's coordinate offline after this meeting. Gary?
Yeah, just another topic. I'm still a little bit confused and a little bit interested. The people that refuse hookups or treatments and so forth, are there hidden costs involved in this? I'm kind of curious why people would not, accept intervention.
Right.
And it just befuddles me.
I'm not sure there are hidden costs as much as there are actual costs that people understand, because with it's broadly believed, probably not accurately, but broadly believed by private well owners that their water is free. And of course it isn't, because you have to maintain the well, you have to replace the pump if it breaks down, you have to pay for treatment if you don't meet standards and you want to have cleaner water, and that can be very expensive. But because they don't get a water bill every month, the idea of going from a private well to a public water system where they're going to get a water bill every month or every quarter, for some people that's a non-starter. And a lot of folks who we have approached, going all the way back to 2016 when we first started doing this work in Litchfield, there were a handful of folks who just says, I'm not going to pay a water bill. I'm not going to do that. I'm happy with my water. It always tastes good and I feel great. So and despite our efforts to educate them and help them understand the potential risks, and also to help them, we did some work to help people understand what the actual annual costs are of owning a well. But I think, for 95% of the people we communicated with, they were persuaded. But there's always a small group that believe what they're going to believe, and that's my understanding why. Or some people don't feel that they're necessarily going to get safer water if they get water from a public water system. They don't necessarily trust that it's going to meet standards, or that there's going to be some other, some people don't like chlorinated water. There are a whole host of reasons why people might prefer a private well over a public supply. So that, I think, is what's behind it.
I've made sure there wasn't any other kind of hidden, tax or some other hidden barrier. But
no, I don't think so.
What you've outlined is my understanding. Thanks.
Sure.
Other questions for Mike? Okay, if not, we'll move on to DHHS. Leanne, please give us your update.
All right, good afternoon, everyone. I'll start out with an update on the Merrimack cancer investigation. I know that the quarterly report for the project was shared along with the meeting agenda for this meeting. So there's a little bit more detail in that. So I'll just give kind of a broader overview. Dartmouth and HHS recently met with the project's advisory boards. The Scientific Advisory Board met on October 28th, and the Community Advisory Board met on November 1st. The Scientific Advisory Board has 2 new members that have cancer and environmental epidemiological experience. Dr. Harvey Checkaway is a professor of family medicine and public health at the University of California, San Diego, and specializes in environmental epidemiology. His research has addressed the health impacts of a wider range of environmental contaminants, including various occupational exposures. Dr. Carl Kelsey is a professor of community health and pathology and laboratory medicine at Brown University. He's the founding director of the Center for Environmental Health and Technology. He's experienced in the application of laboratory-based biomarkers in environmental disease, focusing on chronic disease epidemiology and tumor biology, to understand individual susceptibility to exposure-related cancers. So they've both joined the Scientific Advisory Board. The team continues to develop the study design and the institutional review board protocol, and is working on getting IRB approval. I think we've talked about this in previous meetings. The team is working with the University of New Hampshire Survey Center to deploy a survey to a representative sample of adult residents in New Hampshire. The survey will consist of approximately 40 questions, including topics around concerns around environmental health issues and impacts to health, risk factors for kidney cancer, health history, residential history, and willingness to take part in a larger study and engage in specific study activities. The survey will be distributed to the 8,500 strong Granite State Panel, and we estimate receiving about 1,500 responses. The UNH is going to oversample residents in the town of Merrimack and surrounding 8 towns to ensure that we're getting feedback from the study area. In response to the community engagement studio participants' feedback, we're also using that survey as an opportunity to offer information about how New Hampshire residents can get their private wells tested. The survey questionnaire has been approved by the Dartmouth College IRB and is scheduled to be deployed starting November 21st. Sorry about that. The online questionnaire aimed at soliciting community feedback will remain live until the end of the project on the project's website. Dartmouth and HHS continue to work on analyzing the cancer data and have been working closely with members of the Scientific Advisory Board on the process. Interim findings of the data analysis were shared with the Steering Committee, Scientific Advisory Board, and Community Advisory Board. As part of this analysis, the previous analysis performed by HHS on data from 2008 to 2018 will be updated by adding additional years of data. So the full data set will be from 1995 to 2021. HHS received feedback from this commission and from community members regarding an interest in completing similar analyses on other types of cancer data. Since this feasibility study is ongoing, HHS doesn't have any plans at this time for further analysis of cancer rates in Merrimack or the surrounding towns. And I can provide, my notes will provide a link to that prior study if you haven't seen it already. So while it is possible to pursue the analysis, we don't feel like repeating the population level cancer analyses to add more data at this time will result in additional actionable steps currently. So the results of the kidney cancer feasibility study is kind of the first step to obtain preliminary and more detailed data to inform any kind of future research study. And so we recommend that we allow Dartmouth to complete its work on the feasibility study and invite them to present the findings to this commission either in late spring or early fall of 2025. I did want to bring up some other work related to cancer cancer-related work being done by HHS. So the cancer program is updating New Hampshire's cancer burden report, which is a statewide analysis of cancer incident rates from the period of 2017 to 2021 for all types of cancers. This will be done at a state level, not by town or community, but we expect that this will be released in February or March of 2025. This report is an important tool for the cancer program to help focus public health work related to cancer prevention. And I can provide a link in my notes to the previous cancer burden report, which was the previous 5-year period. And we can share the results of the commission of the report with the commission and present those findings if that is of interest. HHS is also planning to review and update our cancer concern investigation protocol. We have a New Hampshire specific cancer concern investigation protocol. CDC also had a protocol. That's what our current protocol is based on. they updated their protocol in 2022 and expanded it. It's called Guidelines for Examining Unusual Patterns of Cancer and Environmental Concerns, and I'll provide a link to that. So our update to our own cancer investigation protocol will be based on CDC's protocol and may include updating approaches to identifying and investigating unusual patterns of cancers, including proactive evaluation and routine monitoring of cancer at local levels. So we're happy to share a draft of any updates to that for feedback, and we'll keep you posted as that project progresses. The other short update that I have is related to the PFAS clinicians guidance, which we updated recently, New Hampshire specific PFAS clinicians guidance. And we're continuing on working on ways to get this information out to clinicians. We recently included it in our November newsletter for the New Hampshire immunization program, which is distributed statewide. And we're working with our maternal and child health program to send it out to the providers that they work with as well. And that is all I have. I'm happy to take any questions.
I will just say that I had an uninterrupted read through of the clinician guidance. It is an excellent document with lots of hyperlink references. So I really hope that it gets out there. I saw a hand, Nancy.
Thanks, Chris. Leanne, I think I asked this question. I don't remember what the response was during our community board meeting around the kidney cancer study. And if I remember correctly, we had, there was data missing from the VA, and there was, I would imagine that would probably pretty significant chunks of information on the cancer report. And I asked, but I don't recall a response, but I remember thinking it wasn't a response that it made sense to me, about whether or not that data would be included in that was like the missing data for the years for this kidney cancer. Can you find that out, Leanne, for me? I don't remember what, I think they said no, that it was not going to be included, and I don't remember why.
Yeah, so I actually asked about that after the meeting because I wanted to know more about that as well. So the VA data, I think the cancer registry literally got it a week ago, and they anticipate that it's going to take several months to go through that data set and clean it up. They've been talking with cancer registries in other states who also recently got data from the VA, and it sounds like it takes a lot of work to get it in a format so that it can be compared with the data that's already in the registry. So just given the timing of that and the fact that this feasibility study has to be done at the end of June, they don't think that they're going to have enough time to analyze it. Part of what they're going to be looking at is there could be cancers that were reported in the VA data that are already in the cancer registry. So they may have been initially identified while in the VA system and put in their registry, but then later on reported through another doctor to the state cancer registry. So a big part of the process is going through and making sure you're not like putting the same person into that registry twice. So.
Will there be though? I mean, I just know the SIR and everything. We were looking back and it was like 0.99 or over 1, and it changes things. And I'm just wondering, I would hate to see, and I know it's not DHHS's fault. You don't get the information, but I also would hate to see this study say that we've not met this criterion for statistical significance, and that it's not showing what we think it might show because we didn't have all of the actual cases included. So will there be something to say that their data was not included, that there's a chunk that is missing? I think that's important, because without even knowing what the report's going to say, we already know that there's, and I don't know how large a chunk, but I know that there's going to be a chunk of data missing that is available, but given the time constraints of the, I don't know. So I would just hope that that's in there, because I really feel that's important.
Yeah, yep, understood. And so, some sort of acknowledgement of that in the report seems like it would be helpful. I think just in terms of evaluating the significance of that data set, that would need to come after, after they've done, potentially after the report's finished.
Yeah, yeah. Thank you, Leanne.
Yeah, thanks.
Maureen?
Hi, I know so much work went into that. It was a great presentation last week. I was kind of surprised. Did I get that right to say you're not going to revisit? Because my thought was having a great team that uses a very specific process to look at kidney cancer in particular. In my mind, I was very curious about the process. And if we look at the process and how they lengthen the time period, the chunks that they looked at, all that presentation of how they tracked it, I would guess, given the length of our exposure, that there's a huge data gap here that we should all care about. And I would love if their standard of tracking and analyzing this data could be used for the full data set for this contamination area, the way they did it from town and other towns. I mean, it was very narrow because their charge is specific to kidney cancer, but looking at the rest is really important in this community. I think we have from the start an immense amount of data gaps, and the other one that has never been looked at and isn't in any of these data sets is pediatric cancer. We know the CDC numbers only that we can look at that talk about the nation, the state, and county and areas, but we as a state have not looked at that in this area. So, we know the health research, we know, which parts of the body are impacted by PFAS, we know our exposure, but there's a huge data gap when we don't do what we can to take the data that's there and update it and have a plan for moving forward, because it isn't as simple, unfortunately. I wish it was for my family and my friends and neighbors that when you stop your exposure, your health in a short order of time turns around. But, this is the most and only persistent endocrine disruptor to the extent that when exposure stops, you don't excrete it. It isn't magically gone. So I really urge us to think, I don't know if you need resources or direction from legislators or what you need. I don't think you can just do it because you feel like it. I'm not that naive, but I would love to know what you need to be able to do that, to kind of look at this process, not as thoroughly as they did, when they got into all the kidney, tracking, but at least take the data set and go back, use the coding, right? There's a new coding way that they kind of figured out that sounded very complicated. If we apply their process to the cancers, as Nancy said, that were very close to that, cutoff that was given, and look at the length of time and make a point to track it, I think that would be really important, because what that does is it just doesn't validate us. That's great. Validation goes a long way to mental health, but it also allows us to have this way to send alerts and give a heads up to physicians in the area that we see something is trending up or of potential concern. We don't have to go definitive with this, but that will allow them to be on the lookout and be more vigilant so people can be screened and hopefully have earlier detection. And I know of 3 lives that were lost in the last month in this community that, they weren't 20, but they weren't 90, people in my age group that have passed from, various cancers that came back, and they're very similar in nature. So this is so important. This is so important to us.
Amy, if you're done, Maureen. Amy Costello.
Hi, it's nice to be back, having survived the battle with breast cancer. Taking maybe all 3 of these concepts together, thinking about what we're just learning about the USGS resource and the predictive modeling for PFAS, I would imagine that DHHS is going to feel some pressure to better understand cancer rates, and would like to understand, maybe kind of like the conversation we were having with Mike, a little bit more of the why not. You do have about 5 rates that are sitting really close to the 1.0, dangerously close to the 1.0. And to not pursue those when the code is already written, the data just needs to be updated. And I understand that's not a small feat, but the data is going to be updated anyway, because you've got to use it for the Merrimack investigation. So assuming that the data has been updated, because you don't update it for just one cancer, you update the data set, that would probably be a really good opportunity to get ahead of the inquiries that are going to come. You know, Dover's not a focus right now, but it will be because I live there. And I would just imagine that, you know, if we can sort of work with DHHS and get ahead of this a little bit, you know, it'll be better positioned rather than, you know, DHHS kind of getting the hammer when the PFAS data comes out and sort of being behind the 8 ball as far as updating the data from 2018. It would seem with St. Gobain leaving too, that, you know, they're not going to go quietly. There's probably going to be some press about that if we're not seeing enough already. And certainly understanding the why would call attention to what kind of cancer rates we have in that area. And if the best we could show is from 2018, I'm just afraid that's not going to be a good look.
Thank you. I appreciate the feedback and comments. I can certainly take that back to others at the department. So
thank you so much, Leanne. I appreciate you hearing me.
Yeah. And I'll also point out, I can put a link in the chat that, you know, there is a way to submit a data request for some of these data. I mean, obviously it has to be done in a way that's, you know, not violating any of our confidentiality protocols, but that's, you know, that's another avenue as well. So I'll put that link in the chat.
Can I make a follow-up? Can you let us know at the next meeting if this will require a data request or if this is something that the department will do because it behooves them to do it? I would hate to be redundant, you know, and have them starting to work on it while we're fulfilling a data request that, you know, is basically going to say something like, you know, please repeat the analysis that was done on the 2009 to 2018 data.
Yeah, I mean, again, I can take that back. I know right now there's not any plans to do that. You know, the thought is to continue with this project with Dartmouth, because that really is the, you know, the next step if there was an elevated signal in any of the other cancers to begin a study like the one that Dartmouth is doing right now. So so that's, you know, that's the thought behind that. So. Did you have another question? You had your hand up.
All set, Amy?
May I ask? I mean,
Please.
I'm just concerned. I'm concerned that we, you know, public health has already shown us that they can handle a pandemic and manage other public health crises. And so I'm concerned about pushing off what could be a significant problem with colorectal, non-Hodgkin lymphoma, urinary bladder, prostate, because we're focused on kidney. And you know, if it's a data run, I think we should think creatively about the resources in the state. You know, I still have some connection with IHPP at UNH. It could be that, you know, there's other sources that could be running the data, but I think a no doesn't land very well. Maybe a when, but would love to know more about the schedule for that. Thanks, Leanne.
Can I just add one little piece to that? Everything you said, Amy, I so appreciate that. It's spot on. I think the community would be applauding you to hear this. I wish they could. When you talk about, Leanne, the signaling, right, over kidney cancer, we have to remember that data set is outdated at this point. What we see for patterns in the last 5 years is quite alarming. And we're not going to get a signal if we don't update the data set. So, there's a challenge there. We have to do this. We owe it to this community, given that, the health monitoring bill from several years ago that Nancy worked so hard on, which was sensible, it was very limited, was vetoed, given that the class action suit throughout health monitoring is a polluter responsibility, the only class action suit in the nation that's done that. That's pretty astonishing. And the Supreme Court judges cited as the reason for their decision, the governor had vetoed the 2019 bill. So we have this huge problem here in terms of what's right. And we can't just brush this. I'm not saying you're trying to brush it under the rug, but that's how we feel. We really owe this to people from a public health perspective to really look at this. We're not going to get the signal unless we update the data. Thank you.
Leanne, is it possible to just take the VA data and determine the unique number of patients, just looking at names and dates of birth without doing anything further to know order of magnitude? Is it 5 unique patients? Is it 50? Is it 100? I think if there needs to be additional funding or an extension to amend when the report's due, or the full report is due, it might be useful to know that.
Yeah, I can talk with Dartmouth and the cancer registry folks at Dartmouth about that a little bit more. I mean, that was something that we had talked about. They could get the data integrated, and then we could look to see, was it how many in this community, how many additional cases were added? Maybe they were already in the cancer registry. So I don't have a sense of their full process. I think they would have to get the data cleaned up and then do that kind of as the last step, but I can certainly talk to them more about that. I'm not familiar with all the details of how that they would need to do that.
Okay, appreciate it. Okay, any other questions for Leanne? And if not, we'll ask.
Sorry, I just want to add, just because I sit on the committee, it would be remiss if I didn't say this, but they will have to contemplate the denominator, not just the number of new cases, but contemplate the of the population, or of the additional population, and then also be able to calculate the confidence intervals from there. So it is fairly complex. It's not just a matter of adding the new cases. So I certainly appreciate the work.
Okay.
That's it, sorry.
Okay, Maureen, are there any updates on legislation?
Yes, thank you, Mr. Chair. Very briefly, the filing period on the House side for bills for next year is going on currently November 6 through 22. I'm not sure about the Senate side. They have their own rules and it's a little looser. Organization Day, that is the swearing in of the new legislature as a result of Tuesday's election, will be on December 4th. So on that day, the new legislature will take charge for the next 2 years, committee assignments, commission assignments, etc. Which leads me to our membership for our own commission. We do have that chart, and I know we wanted to take that topic up again after the election, so just something to put on the soon radar. Started a chart for the 2025 legislation. I've begun looking through LSRs that were filed in September for the upcoming legislative year, and there will be more, I'm sure, in the next 2 weeks with the filing period we are in. But if anybody has any specifics to be added into the 2025 chart, let me know and I can start inserting that. And I think that will do it. Thank you all very much.
Okay. Thank you, Maureen. So I think that brings us to the close of the agenda. Last meeting, I asked sort of an off-topic, a little bit question of Mike, who referred me to Andy Fuller, which was whether the GIS coordinates of particular test sites were readily available. Andy told me about the ones that I was interested in, which were next to a piece of property that was being developed, but he said on a case-by-case is to consult with him on those exact locations. So that was of some relevance in the development of a site. And being on the planning board in my town, it's something of a recurring interest and need to have those things addressed, so at least we don't follow worst practices. So that's something that I might try to address in some respect with the municipal association, to try to put together some guidelines. We've had a couple of car washes come in and have added conditions that they use non-PFAS containing compounds that are make conditions of the approval. So I think there are some worst practices that can be avoided. I don't know about best practices, but it definitely is a continuing concern. I was pretty surprised at the high levels of about 2 miles north of St. Gobain on that site. So just something that I think planning boards ought to be aware of moving forward and approving projects. So again, that was a little bit off topic, but I wanted to come back to that. And unless there are other questions or comments, go ahead, Mindy.
So I sent you an email, Chris, during this meeting about the SB 85, formerly now HB 1171, environmentally triggered illness commission, has a meeting next Friday afternoon at 3 o'clock. There's a Zoom link that I sent to Chris that we are hearing from 2 prominent scientists from Dartmouth, Megan Romano and Christine Gunn, on PFAS and the studies that they've been doing in the state of New Hampshire. So anyone's welcome to join that meeting if you want to hear that presentation.
Excellent, thank you. And I will circulate that. Any other questions, comments? If not, it is 3:34 p.m. Thank you everyone for your attendance, and we are adjourned.
Everybody.
Bye.